welcome to the Idea Exchange. In today's episode, we are talking more about seizures. I'm your host, OSP, and our guest is.
Vincent Chilemba.
What are the seizures and how do they affect the brain?
A seizure is a sudden onset of signs and symptoms that are associated with abnormal or abnormally excessive or synchronous activity of the brain. So in this case, synchronous means happening at the same time. So it's when the brain is overwhelmed with signals. Yeah. They can be associated with impairment or loss of consciousness, sensory or motor function, and behavioral abnormalities. There's also a concept of epilepsy, which are recurrent and provoked seizures. In this case, someone keeps on having seizures now and again without any triggers present.
What are the different types of seizures?
So we have three major types of seizures. The first group is generalized seizures. The second one is focal seizures, and the third one is unknown onset seizures. So the generalized type, these are seizures that affect the whole brain as a whole, and these tends to show symptoms affecting the whole body, both sides of the body, like the left side and the right side. Focal seizures happen on a particular side of the brain and affecting a particular region of the brain. So this tends to show more limited signs and symptoms, considering the body parts affected. So this can affect one hand or leg or one side of the body or a particular function of the person as a whole. The third group, unknown onset seizures. These are seizures that cannot be accurately classified as generalized or focal.
What are the common causes and the triggers of seizures and how can they be prevented?
A seizure usually happens when there is an imbalance in activation and inhibition of the brain cells. This is usually due to decreased inhibition of the cells, or increased excitation of the cells, or even defective neurons. These are the brain cells when they are defective. So, uh, seizures will result from a disturbance in one of these sections, and they can be due to genetic causes like hereditary, that a particular member of the family passing it to the offsprings or relatives. It can be due to side effects of some drugs. It can be due to systemic diseases that cause systemic inflammation. It can be due to infections affecting the brain or the meninges. These are layers that surround the brain. It can be due to trauma, physical or mental trauma, and it can also be caused due to withdrawal of recreational drugs and alcohol.
How do seizures impact daily life and mental health and relationships?
So when seizures are recurrent, that means when seizures happen often to a particular individual, as in a case of epilepsy, I can limit the activity one can safely participate in. For example, it wouldn't be safe for someone who has recurrent seizures to drive in case they have an episode while they're driving. This can cause an accident, or to operate machinery for the same reason that they might get a seizure episode whilst they're operating particular machinery, especially heavy machinery. Uh, on effects of impact of seizures on mental health, this can be due to stigma and misconceptions around seizures. Uh, these stigmas can trigger mental health challenges like anxiety and depression. Also, hopelessness from lack of knowledge about the condition and limited access to healthcare services can worsen the mental health challenges. Uh, Relationships can be indirectly affected due to behavior changes that are associated with seizures and also with the mental health aspect of it. So when someone is mentally, uh, I wouldn't say challenged, when someone has a mental health problem, they tend to be protective. They might end up breaking relationships because of the mental health issue. So seizures can indirectly affect relationships in that way.
What are some common misconceptions about seizures, and how can we raise awareness and reduce stigma?
All right. So in communities, especially rural communities, there are some misconceptions about seizures, and I'll just mention a few. Some people believe that a full moon can trigger seizures, and some people also believe that seizures due to spells, like maybe a relative of them has casted a spell, and yeah, like in Chichewa Matenga. So they believe that it's not natural. It's like human made, and also some communities believe that people who have seizures are mentally challenged, like they can't be functional members of society. And to reduce this stigma that are associated with seizures, or people who have uh, what who may experience seizure episodes, we should have awareness campaigns to make people aware of what seizure is, and to teach them that whatever misconceptions they have are not true, and they should change their mentality towards seizure and people who have seizure episodes.
What are some innovative technologies or devices that can help detect, predict, or manage seizures?
So, specifically in a clinical setting, when someone is admitted at the hospital, they might be put on a device that scans the activity of the brain in real time, like at any given moment. So, this device is called an EEG, short form of electroencephalogram. Now, this device can help detect seizures and brain patterns associated with seizures. So, when a patient is put on this machine, uh, healthcare practitioners can check the readings of the machine, and be able to know when a patient is more likely to have a seizure and when a person is having a seizure. Uh, and also, some studies have managed to identify changes that are observed in patients just before experiencing a seizure. And these changes are often called auras, and they can be a person experiencing a particular smell or taste they are just before experiencing a seizure. And being able to know, or to notice earlier that someone might be experiencing a seizure or is about to experience a seizure, can help to make the surrounding safe in case the patient falls and converses. So it doesn't necessarily help us manage the patient with seizures, but it can help us prevent injury and trauma that can result due to unsafe surroundings.
How can caregivers and loved ones support individuals living with seizures disorder?
So caregivers can give these particular individuals emotional support to reduce or prevent the mental health challenges. So this can be in form of being around them, listening to them, uh, chatting with them, allowing them to share their challenges, and generally being emotionally available for the individuals. They can also help by making sure they are able to access healthcare services. So And this can be encouraging them to visit the hospitals, going to hospital visits with them, encouraging them to take their medication if they're put on any, and helping them understand their condition. They can also help by they themselves understanding the condition, like what seizures are, and having a better understanding can help them manage the patient better, and also can help to make the patient also aware and understand the conditions. They can also help by encouraging them and giving them hope that that their condition that their condition is not the end, and they can be able to achieve particular goals in life, and being there supporting them through their life goals.
What are some strategies for managing seizures related anxiety and depression?
So as I mentioned earlier, individuals who might experience seizures, they are prone to have mental health challenges like anxiety and depression. These challenges are not necessarily unique to individuals with seizures. They're not different. Like when someone is anxious, when a normal person is anxious or depressed, and when a person who has seizures is anxious or depressed, it's not really different. It's basically the same condition. So the strategies used are not specific for patients who are prone to having seizure attacks. The same challenges that can be used on any other particular person can also be used on individuals who have seizure disorders. So just to mention a few, we can we can encourage the patient to do physical activities, to explore their hobbies, to go for therapy, to attend mental health support clubs, and if the mental health disorders are so severe, we can consider medical interventions. So putting them on drugs to help reduce the mental health symptoms.
What are some strategies for reducing seizure-related trauma?
Most of the times when someone has a seizure episode, they usually fall down and convulse. So this can lead to trauma related to seizures. So these traumas can be prevented by following some steps. Just to mention a few, they can be prevented by they can be prevented or reduced by making the surroundings of someone who is likely to have seizures safer. This can be by removing sharp objects around, by removing hard surfaces, and by making sure that they are not close to any open fires and potential causes of electric shock. Uh, can also the patient or the individual who is more likely to have a seizure episode can take note of the changes that take place just before the seizure, so that they can secure themselves or move to a safer place. So this can also be done by a bystander, someone who is close to the patient. When you notice that someone is about to have a seizure, or when you notice that someone is having a seizure, you can help them by moving them away from objects that can injure them to a safer place. And even at a safer place, you have to stand by them to wait until they're okay, they're normal, um, so that they cannot be injured. For example, when someone maybe converses close to a load, bystanders can get that particular person and set them aside or somewhere safer, which is not close to the road, in case they might be run over by vehicles. Yeah. So you can also encourage individuals who are prone to develop seizures to not operate machinery and drive vehicles. This is to reduce accidents that can happen when someone has a seizure episode.
Can seizures be prevented, and what are some ways to reduce the risk?
Yes, some seizures can be prevented. So these are seizures that are not of genetic genetic nature. So they can be prevented by avoiding the specific causes of the seizures or the specific triggers of the seizures. So these causes or triggers can be metabolic imbalances, systemic inflammation, infections, trauma, or drugs. So uh, generally, this can be prevented by maintaining a good physical health, and specifically for drugs can be prevented by avoiding the creation or use of drugs, or if the drugs are therapeutic, the seizures can be prevented by evaluating the effects of the drug. So maybe changing the dosage when they notice that the drugs are causing seizures, changing the dosage, or maybe just stopping the drug altogether, so that the seizures can be stopped.
What is the relationship between seizures and mental health conditions like depression and anxiety?
Uh, there is a relationship between seizures and mental health conditions, and in general, there is a relationship between mental health conditions and almost any other medical condition, especially chronic medical conditions. So, when someone has seizures, they can develop mental health conditions. This can be due to a lot of reasons, maybe hopelessness, feeling that they cannot achieve what they plan to achieve because of the condition, in this case, seizures, and this can cause anxiety and depression. It can also be due to stigma and the attitude of the people around towards the particular condition. For example, specifically on seizures, in some communities, when someone has seizures, it means that maybe uh, they have had spells casted on them, and maybe these people can be avoided by the general community, and this can leave them lonely and trigger or lead them into mental health conditions. So there's definitely a link between uh, seizures and mental health conditions. And when a patient uh, or an individual has seizures, especially in the communities, they are prone to mental health conditions.
How can an individual with seizure disorder maintain independence and autonomy?
So since seizures aren't a physical disability, individuals with seizure disorders can definitely maintain independence and autonomy, just like anyone else. Um, Apart from being discouraged to drive and operate the machinery, these particular individuals, they can do almost anything any particular person can do. So there isn't any specific strategy to help these particular individuals to maintain independence or autonomy, because they are not unable to. But in cases where they are not able to function properly due to physical effects the seizure may have on their body, they can they can be helped through physical training and physiotherapy to regain function and to function normal, to gain independence and autonomy.
What are some seizure-friendly lifestyle changes or habits?
These lifestyles would be ones that prevent uh, or reduce exposure to triggers of seizures, or uh, minimize episodes of seizures in people with recurrent seizures. So this can be stopping or avoiding the creation of drug use, as some drugs uh, have been proven to be triggers of seizures. Can also be evaluating therapeutic drug usage and making appropriate adjustments. So some therapeutic drugs can trigger seizures, and in this case, these particular drugs need to be evaluated and have their doses changed, or the drug changed, if that's an option. Can also be avoiding other specific uh, triggers of seizures. These are specific triggers of that particular patient or particular person. So they will need to evaluate the patient or the person and find out what are the specific triggers to their seizures and avoiding those. Can also be maintaining a good mental and physical health. So general health, when someone is healthy physically and mentally, it can help to reduce incidences of seizures.
Can seizures be triggered by environmental factors? And if so, what are they?
Seizures, of course, not always, can be triggered by environmental factors. So this is in particular individuals. Doesn't mean that any patient that has seizures, or any individual that has seizures, they had an environmental factor leading to the seizure. So some of the environmental factors are drugs. Uh, so this can be recreation drugs and alcohol, or even therapeutic drugs. And can some other environmental triggers would be environmental changes that can affect the metabolic levels and concentration of metabolites. So this can be dehydration, or maybe increased activity or reduced activity. Uh, Another environmental trigger can be uh, environmental trigger can be environmental forces that can affect mental and physical health. So this can be uh, environmental factors that uh, affect the mental and physical well-being of a particular person.
Alright, how do seizures impact the cognitive function, memory, or focus?
So seizures do impact cognitive function, memory, and focus, but most of the times these are not permanent effects. So there can be the cognitive function, memory, and focus can be affected around the moments around a particular seizure episode. But in some individuals, they might have uh, permanent permanent impact on cognitive function, memory, and focus. So in these particular individuals, they might maybe have cognitive impairment, they can have loss of memory, and they can have impaired focus. But these are specific cases, and uh, they do not happen so often. So we can say they are special cases.
How can individuals with seizure disorders navigate healthy care systems and access quality care?
Since we do not have a highly advanced and complicated health system here in Malawi, navigating the system is not particularly complex. So, from the point of diagnosis, an individual with seizure disorders would be referred to appropriate clinics to get treatment. and this is only when the treatment cannot be initiated at point of diagnosis. So there isn't any strategies or any guidelines on how they can navigate the healthcare system, because there isn't a need for any, as our system isn't so complicated and is accessible to any individual that might have seizures.
How can we promote seizures awareness and education in schools or workplace?
So to increase awareness on seizures, the government or the communities can implement public lectures, can host or organize public lectures. These will help to educate the general public on topics around seizures, so to make them aware of what seizures are, how they can identify a person who is having a seizure, and how they can manage the situation. We can also include topics surrounding seizures in our education curriculum, and in workspaces where they have individuals that have seizure disorders, the employer should be encouraged to educate their employees, anyone around the workspace, on how they can make the workspace safer, welcoming, and conducive for individuals with seizures. They should also learn on how they can manage an individual with a seizure episode, in case that particular workmate has a seizure in the workspace.
What are some resources or support groups for individuals living with seizure disorders?
So in most of the communities, there are no specific support groups and resources directed to individuals with seizures, since the population of people that might have seizure disorders in the community, they might be fairly low. But these individuals, they can access facilities that are welcoming in most communities to any individual in the community. Facilities like youth centers, sports clubs, community groupings and clubs, mental health support groups, and even charity organizations. Specifically on charity organizations, they can be directed to charity or charitable organizations that can uh, give them resources to help manage any uh, healthy or economic stress that might be on them due to the condition.
All right. Thanks for your time.
Thank you.